Good afternoon, dearest viewers, and welcome back to another session of Facebook Live at KL Fertility Centre. My name is Emma, I'm from Get Dog, and together with me is Dr. Paul Tay. Thank you so much, Doctor, for taking time out to do this. It's a great opportunity to clarify certain questions. I believe that Dr. Paul, you just recently joined the fertility.
Yes, I joined here 2 weeks ago.
Oh, 2 weeks ago. Oh, so it's very recent. Settling well?
Yes, I like it, enjoying it.
Okay, great. That's good. So maybe just a bit of background of Dr. Paul. He graduated in a medical degree in University of Belfast in UK in 1992. After that, he went on to pursue his MRCOG as well as a diploma in family planning and reproductive medicine. With all this rich and long experience, 30 years of experience all around the world, he has managed to perfect his gynecology as well as reproductive medicine and laparoscopic surgery. So, Doctor, maybe you would like to add on more about yourself?
Sure. Yeah. Thank you, Emma, for the introduction. My name is Dr. Paul. I am a newly joined consultant reproductive surgery in KL Fertility Centre. So, as Emma said, I obtained my MRCOG, which is the postgraduate degree in obstetric and gynecology in 1997. After that, I developed an interest in fertility work, so I got myself a training post in Sheffield Fertility Centre in UK. That's in 1997. The 2 years I spent in Sheffield gave me a very good insight into what IVF treatment is all about. And at the same time, I also did a lot of research into luteal phase defect. And because of that, I also got a postgraduate degree, Doctor of Medicine, in 2002. That was awarded by the University of Sheffield. After that, I left UK. I came back in 2001 and I joined University Malaya Medical Centre as a lecturer and subsequently as an associate professor. So I run the fertility service there for about 7 years, helped to train undergraduate students and postgraduate students and doing a lot of clinical work. And after that, I left my government service and joined Prince Court Medical Centre since 2008. So I've been running the service in fertility in Prince Court for 10 years. So all in all, I have about 19-20 years of fertility experience, probably performed more than 2,500 IVF cycles up to now. I really enjoy helping infertile couple conceiving. I like this field. It's very interesting and very innovative and very challenging.
Challenging as well, yeah? I guess so. All industries, they will have their challenges and pros and cons.
Absolutely, yeah.
So we will also be giving away 3 free IVF consultations. How to win this is all you have to do is submit your questions, if you have any, into the comment box below, and we will choose the winners from there. So it's very simple. Just submit your questions. We will choose 3 winners to win this free IVF consultation with Dr. Paul. Yeah. So today, our topic would be myths and facts about PGS and PGD in IVF. So a lot of couples, they have a lot of curiosity and concerns as well, because there are a lot of hearsays. You should do this, PGD will do that, and so it's very confusing. So maybe, Doctor, you can give us a brief introduction of what this is. So,
sure.
What is PGD and PGS?
Yeah, maybe before I go into PGD, I just give a little bit of history about IVF and why PGD is important. The first IVF baby was born in 1978, and ever since then IVF become so popular, and up to now there's already 4 million IVF baby born worldwide. Yeah, a lot. In IVF, we take sperm, we fertilize with an egg, and we created embryos. And before we put the embryos back into the woman's body, we grade the embryos into good and poor grades based on their external appearance, going with the number of cells they divide, how quick the cells are dividing, and so on. Of course, everybody likes to put in a good grade embryo because we believe that will give us a best chance of success. But we do know that our grading system is not very accurate. There are times where a very nice, good-looking embryo on the outside may be genetically abnormal on the inside. So that's why, time and again, after we put in the so-called good embryos into women, they don't get pregnant. Or worse still, sometimes they get pregnant but miscarry. So that's because of the abnormal genetic disorder. Yeah, and for many years we can't overcome this because there's no technology to test for genetic problems. So we're very fortunate about 3-4 years ago where there's a new technology comes along called PGS, which stands for pre-implantation genetic screening. Yeah, it is proven to be very useful, and it is a very innovative and groundbreaking invention. Allow us to study the genetic disease in the embryo.
I see.
Yeah.
Okay, so it screens the genetic components within the embryo.
Yes, right. That's right. That's right. Before, of course, in IVF, we want to replace the embryo into the woman's body eventually, but this allows us to study and choose which is the better embryo to put in.
Okay, that makes sense.
Yeah.
PGD?
Okay, sorry, maybe I should elaborate a little bit more on PGS. PGS is a screening process. As the name suggested, it's a screening process. It basically used in, it can be used in all suitable IVF embryos to look for any abnormality. So it's a little bit like a siphoning process. It siphons out the normal from the abnormal embryos, so that by placing only the normal embryos, the woman will see a higher success rate and a lower miscarriage rate. You were mentioning PGD. Yeah, PGD is another version of PGS. It stands for pre-implantation genetic diagnosis. It's only applied to women or to couple that already know they have certain genetic disease. In PGS, you do it on couple that's healthy. You are not looking for anything specifically wrong. But in PGD, you are doing it on women or on couple that already know they have certain defects in them. One of the common examples is beta thalassemia. It is a very common disease in Southeast Asia, including Malaysia. In beta thalassemia, both husband and wife carry the gene defect. So when they conceive their child, they have 25% chance of having a baby who will get a severe form of disease called thalassemia major. So in this disease, the baby is very ill. They require multiple blood transfusion. They will have higher chance of liver or kidney failure. Their life expectancy also are a lot shorter. So PGD is very useful in picking out those affected embryos and putting in the normal embryos into this couple. So saving them the agony of going through termination of pregnancy or going through the agony of bringing up a very ill child in the future.
I see. Okay, that's great. So when a couple is undergoing IVF, when is it? When would they know when to opt PGS or PGD?
PGS, as I said, is a screening test, so it can be done in all IVF patients. And like I said, we are not looking for any specific disease. We are just a siphoning process to choose or to select the best embryos. But there are three distinctive group of patients that will benefit most from PGS. Elderly woman who's going for IVF treatment. Any woman above 37 years old should consider PGS because their chances of having chromosomal abnormality are much higher. The second group are those women who has recurrent miscarriage. That's defined as 3 consecutive miscarriage in their life, and they are also at risk of a higher risk of chromosomal abnormality. The last group are women who has recurrent implantation failure, meaning they have done several IVF attempts, putting in embryos, but nothing happened. They don't get pregnant. So PGS may be a useful tool to give them the answer.
I see. Okay. So earlier you were mentioning chromosomal abnormality. Like, what are the abnormalities that you would see in the baby? Maybe not in the embryo. As a baby, what are the effects of that?
The abnormal chromosomes can give rise to several things. Mainly, the embryo may not implant, so that leads to infertility.
Yep.
Or sometimes when they implant, but because of the chromosomal problem, the woman miscarry in the first 3 months of pregnancy. And another scenario is sometimes chromosomal abnormal embryos grow all the way and deliver, but the baby has certain defects. The example, the common example is like Down syndrome. Down syndrome is a commonest chromosomal abnormality. So these babies are mentally and physically retarded. They do not live a normal life like normal adults.
Okay.
Yeah.
I see.
Yeah.
Great. So maybe we can go into our first myth. You kind of sort of clarified this already, but maybe we just
Yeah.
So is PGS only for older women?
Yes. Well, yes and no.
Right.
Definitely older women should consider doing PGS, as I said earlier, because they have a higher chance of chromosomal abnormality. From my experience, and as well as proven by other studies, women in their late 30s, at least about 50% of the embryos are abnormal.
Oh, 50%, that's quite high.
And if the woman comes at 45 years old to do IVF, the number rose to almost 80%. So the figure is quite frightening. And what is also interesting is if a woman is young, let's say 30 years old or below, about a quarter, about 20 to 25% of their embryos are also abnormal.
Oh, that is still quite a high number
That's right.
as well.
Yeah. So basically, human embryos are quite defective. Yeah.
I see. Okay, great. So the second myth here is PGS done to only look for Down syndrome? Since that was one of the most common defects.
Correct. Yes.
Yeah. So
yes.
is this PGS only done to screen out Down syndrome?
Yeah. Yes, PGS is done to mainly screen out any form of chromosomal abnormalities. Normal human like us has 46 chromosomes, what we call euploid. But sometimes during the process of fertilization, the chromosome, something went wrong, the chromosomal number may be abnormal. They may only get 45 or 47 chromosomes. This is what we call aneuploidies. Down syndrome is only one of the aneuploidies. It's affected on chromosome 21. But these aneuploidies can affect any sort of chromosome from number 1 to number 23.
Right.
So any sort of aneuploidy chromosomes can be picked up by PGS.
Right.
That's right.
Okay.
We always talk about Down syndrome because it's the commonest. But don't forget there are other chromosomal disorder like Patau syndrome, Edwards syndrome, and so on.
I see. Okay. So because Down syndrome is the most common one, and it affects the 21st chromosome, that's why it's mostly talked about.
Correct.
But there's still the other 1 to 23.
Correct.
to
Correct.
consider,
And because of that, people always think there's only one type of chromosome. It is not. The problem is a lot bigger.
So, PGS can be more than just Down syndrome screening. Great.
Oh, sorry. Perhaps I want to add on as well.
Sure.
There's a group of patients. I did mention earlier, like recurrent miscarriage or implantation failure. They get very why the treatment doesn't work, why the pregnancy doesn't progress and deliver healthily. PGS can be used to give them the answer, because a lot of times when they fail the IVF, the doctor say, oh, well, one of those things, nothing we can do. They don't get an answer. But PGS perhaps may be useful in giving them the much needed answer by telling them your embryos are abnormal. So it may not guarantee them a success, but it at least gives them an answer.
Yeah. Okay. At least
So
understand why it
correct,
failed. Yeah.
correct. So that's another use of PGS.
I see. Okay, that's great. So another thing is PGS and PGD can guarantee a healthy baby. Is that true?
I always get worried when you use the word guarantee, because in medicine, very seldom things are guaranteed. But yeah, I mean, PGS is very accurate. You have a 99.4 to 0.5% chance of accurately detecting any aneuploidy embryos. but like any test, there's always this false positive, false negative results. So I think first of all, the patient has to be aware of that. Second issue about a normal baby. Well, okay, PGS, as I said, only detects the chromosomal abnormal embryos. There are many other rare form of genetic disease that's not tested. So although we screen out the most common disorder, but there are other small disorder that we cannot rule out. So we cannot guarantee 100% success.
Okay.
Yeah.
I see. And PGD, can it guarantee?
Okay, PGD is a little bit different. PGD use are more specialized because it's targeting on certain gene defects. Like I mentioned, thalassemia, Huntington's disease, some sex-linked disorder like hemophilia or Fragile X syndrome and so on. So first of all, that gene defect has to be identified. And that is, if there's an available commercial probe that's available to detect that defect, yes, it can rule out that particular disease. But as I said, there are so many genetic diseases in this world, we do not have all the probes for every other disease. So only the common type we have.
Right.
Yeah.
Okay. In this case, has a couple ever they themselves are not aware that they had a genetic defect? Would that be?
Yes, they find out several ways. One, like for thalassemia, sometimes they only found out when they have an affected child.
Oh.
Then only they found out they are the carrier of that disease. There are other couple who has a family history, their sister or their parents or their siblings has the affected disease, then they know. So there are several ways how they find out. But some are totally unaware.
Oh, I see. Okay, great. So maybe this would have a little heads up before it really occurs, no?
Well, actually, no. We can't do PGD on a big population because it's too complicated, it's too expensive. So we only do it on couple that already know they carry the disease. We do PGS for screening, but PGD is done on women, on couple that already know they have a problem. Yes, yes.
Yeah. So the next myth: low-grade embryos are chromosomally abnormal. Is that?
It is true to a certain extent. In IVF embryos, we tend to grade them based on their appearance, as I mentioned earlier. Of course, we all like to put in good embryos, chance of success, but there are times where there are no good grade embryos. You are stuck. You are very restricted because the women only have poor grade embryos, and after putting it in, occasionally you do get successful pregnancies too. That's first point. Second point is, no doubt, there's a relationship between poor grade embryos and genetic abnormality, but this correlation is not perfect. Time and again, I also see after putting in a poor grade embryo and they conceive, after knowing that the PGS show a normal genes in those embryos.
Right. Okay. So it's not always the case.
It's not always the case. That's right. That's right. Yeah.
Great. So another myth here is that if both parents are healthy, then the baby will be healthy as well.
Not necessarily.
No. Okay.
Abnormal baby happen by random. It doesn't always have to come from abnormal parents. When the sperm carries 23 chromosomes, fertilized with the egg, which also have 23 chromosomes, the resulting embryo has 46 chromosomes, and this is called euploid embryos. This uniqueness of the chromosome gives the baby the distinctive looks, character, gender, and so on. But when the egg and sperm comes together, the chromosomes are broken up, mixed, redistributed, and reformed. So things can go wrong. The embryo may miss one chromosome or may acquire one extra chromosome. So this is what we call the aneuploidy embryos. And this can happen randomly to the most healthy couples. So no, nobody is immune. Everybody has that risk.
I see.
The older the woman is, the higher the risk.
Oh yeah? Okay, noted on that. So, you know, couples, if you are healthy, it doesn't mean that your baby would. There's no guarantee that your baby will be healthy as well. So maybe in this case, even though you're healthy, it's best to maybe just undergo this PGS, just to be precaution on this, right?
Well, I mean, there are other issues about PGS as well, which we will discuss later, like what are the downside of PGS, because so far we've been saying all the good things about it, but of course we had to have a very neutral view. So there will be some issues that we'll talk in a few minutes about the downside of PGS.
Sure, definitely. We need to know both sides of the story.
That's right, exactly.
This.
Yes.
So, I think this is quite an interesting myth, is that PGS and PGD can create designer babies because somehow it's genetically modified, hence you will get the perfect baby, you know, big eyes and tall and you know, all these sort of things.
But it's a misconception actually. Designer baby is a very new technology under a lot of research. Basically, in designer baby, you create embryos using modified genes by inserting specific genes into random parts of the genome to enhance certain characters. So you get, like you said, high IQ, certain color, certain height, and so on. So that's designer baby. But in PGS, we are not creating anything. We are only selecting. We are only choosing the best embryos. In fact, before you do PGS, you have to do IVF, and in IVF you fertilize the egg and sperm in the lab. So when this happens, the chromosomes are already fixed. We cannot change anything. We are just merely choosing the best embryos.
Right. Okay.
So it's very different from designer baby. We just try to avoid certain disease, that's all. We are not creating super baby or whatever, you know.
Okay, noted on that. So for PGS and PGD, the embryos are already formed and you just select from them.
Correct.
Hence, you know, you're not really
modifying it or changing it. We don't have that technology.
Right.
Yeah.
Okay.
Or at least not for now.
Not for now, yeah. Do you see this coming in the future?
Yeah,
Possibly?
very likely, very likely. But there will be a lot of regulation and rules because that's another area.
Right.
I mean, that's totally different from what we are currently doing.
Okay, great. Yes, so just to clarify, PGD and PGS will not create designer babies. So that's clear. Another one is that PGD can be done easily by any doctor in any setting.
No, absolutely not. PGS is a very highly specialized procedure. Can only be done in established IVF units. Even some IVF units don't have it because the setting up cost is very, very high. That's one. Two is one have to do IVF, as I said, before you can do PGD or PGS. So it's a continuous process. So you cannot do PGS alone on its own. So therefore, this sort of treatment has to be carried out in an IVF center.
I see, but not all IVF centers have this PGS.
Correct. And also PGS require skilled embryologists, experienced clinicians, equipment support, the proper setup. So it's not a simple thing to do.
I see, okay, so you need specialized people in a specialized environment.
Exactly.
To do
Exactly.
This.
Yep.
Okay, cool. So what are the risks towards the embryo for doing PGS and PGD? Because you kind of, I won't say tampering with the embryo, but you know, it isn't exactly.
You are in a way tampering with it, but the risks are very small and theoretical. So because you have to create a small hole on the embryo shell to aspirate out the cells for studying. So the process doing that can theoretically damage the cells and causing cell death and making the embryo unusable. So there is a risk, but the risks are small. Also, like I mentioned just now, there's like every test that's this false positive or false negative report, you know. So in the event of false positive report, you may end up throwing away a perfectly healthy embryo, reducing the woman's pregnancy rate. Whereas in the false negative report, you may put in a bad embryo or abnormal embryo into woman, causing miscarriage or abnormal baby. So there's always that small risk. But as I said, overall the accuracy of PGS is very high.
I see.
Yeah.
Okay, cool. So in terms of the mother side, because she will be carrying the baby, are there any side effects on her undergoing this?
Yeah, generally PGS itself is very safe. The PGS embryo has no difference compared to embryo that's just gone through conventional IVF. Yeah, but because PGS has to be coupled or done together with IVF, so of course the risk of IVF also applies, like ovarian hyperstimulation, multiple pregnancy. So risks are there, and also the patient has to go through the trouble of daily injection for about 10 days or so. That's the procedure for IVF. PGS is a very new procedure, so the cost is very high. So actually, you were saying PGS is very good, should apply to everyone. Yeah, it sounds good, but one important point is we have to consider the cost. Yeah. So if you decide to do PGS, it will increase your overall IVF treatment by another 50%, 40 to 50%. Yeah. So cost is always an issue. So that is why it's not very popular yet. I think when the cost of PGS comes down, definitely there's more people taking up.
Right.
Yeah.
I see. Okay. I guess because this is a new technology and you require very specialized people to undergo this.
Yeah.
That's why the cost is so high.
Yeah, that's right. Yeah.
Okay.
So that's why it's we don't do it for every couple. It's not cost effective enough, not at this moment in time. That's another thing you said about risk to the mother. In some cases where the woman has a very low number of embryo or poor grade embryo, after PGS is done, they have no suitable embryo to go back in. So that causes a lot of disappointment to the patients.
Right.
So these are the so-called harm to the mother.
Okay, but aside from that, let's say after PGS and the implantation, would there be any side effects from that?
Not really. It's comparable to women just go through conventional IVF. So that's a slightly higher chance of a low birth weight baby and increased risk of monozygotic twin pregnancy. Yeah, so somehow the big world data has shown that there's a slightly increased incidence. Yeah, but overall it's very safe. Yeah, it's a little bit like our IVF babies for the last 30 years. Based on 4 million babies, we know that it is a very safe procedure.
Right. Okay, great. Now, for here, is it true that miscarriages can still happen after undergoing PGS?
Unfortunately, yes, it can still happen. Miscarriage is a very complicated, complex disease. There are many factors causing miscarriage. Uterine factor, endometrial factor, the hormonal, endocrine, of course genetic factor. So PGS only look at one part, which is the genes. And no doubt the genetic problem account for maybe 80-90% of miscarriages, but it's not 100%. So PGS does not guarantee a success.
Right. Okay. So miscarriages can still happen. It's just that maybe
it will be definitely lower. Yeah, lower.
Okay.
Correct.
Cool.
Yes.
Nice. So actually, we've come towards the end of our Facebook Live. Doctor, do you want to add on any more information about this?
Okay, just to summarize it, I think pre-implantation genetic screening is a very useful test, reliable. It does help couple in choosing, not creating, but choosing the correct embryo to put in to their womb. So they will have a higher pregnancy rate and a lower miscarriage chances. And it can also help to shorten the interval, the time interval from treatment to conception. But of course, one had to consider the costs involved. So basically, that's the summary. Yeah.
Yeah, this entire procedure is not going to be, it's long and quite quick. So actually, we have a comment here. It's quite vague, but maybe I will just read it to you. This Kenny Phillip here, he says, I have a friend that is irregular and can't get pregnant. So what is your advice on this?
I think he meant irregular period, right? It's a very vague question. It's nothing to do with PGS in here, but I think for this kind of circumstances, it's best to bring the friend or maybe their couple to come together for a checkup to see what irregular period meant. Is it because of lack of ovulation? And also pregnancy is a man and female thing. So we also had to check out the man's sperm and the women's status. So I think first thing first, they had to come to seek fertility advice or to seek fertility investigation to see what's the cause of the infertility. And after that, only you can plan the treatment. I cannot elaborate too much because not much information is given here.
Okay, so I guess in this sense, if you are a couple together, do come in and consult and find out what is the issue first before ruling out certain things. Yeah. So that's it from you, Doctor? Anything else you want to add?
No, I think this is basically a good rundown of what PGS is all about.
Yes, it has been very informative. You know, at least we have some clearer picture of what is PGS and PGD, and especially what to expect. Because we don't want to, you know, this is not a very cheap procedure, so we would like to bear in mind that yes, these are certain things to consider, and you know, before you move forward. Yeah. So thank you again, Dr. Paul, for taking time out to answer our questions. Thank you, viewers, for popping your questions. Again, whoever have popped their questions, stay tuned. You may be the lucky winner for our free IVF consultation with Dr. Paul. There will be 3 winners selected. Yeah. So we have reached the end of our Facebook Live. Thank you so much. On the 10th of March, there will be a forum by Dr. Paul and Dr. Helena. More details will be posted in the KL Fertility Facebook page, so stay tuned for that as well. So my name is Emma from Get Dog, so we'll see you next time on the next Facebook Live. Thank you.
Thank you.
Bye.